As part of Rare Disease Day 2020, I'm just going to make a very short video about Kallmann syndrome and congenital hypogonadotropic hypogonadism as a very basic introduction to the condition.
Kallmann syndrome is a form of a condition called congenital hypogonadotropic hypogonadism, or CHH. The only functional difference between Kallmann syndrome and CHH is that Kallmann syndrome occurs with a reduced or absent sense of smell, or anosmia. Apart from the anosmia, the diagnosis and treatment of Kallmann syndrome and CHH is identical. Approximately 50% of cases of CHH occur with anosmia and can be termed Kallmann syndrome. The condition has been known by other terms over the years and in different parts of the world. Kallmann syndrome and CHH are congenital hormone conditions where the communication pathway between the hypothalamus gland and pituitary gland, which are located within the brain, are disrupted. This disruption prevents the pituitary gland from producing and releasing the hormones LH and FSH, also known as gonadotropins, which normally act on the testes or ovaries to initiate puberty and maintain the reproductive cycle. The hypothalamus normally releases a hormone called GnRH that regulates the activity of the pituitary gland. In Kallmann syndrome and CHH, it is this hormone, GnRH, that is most affected. It's either not produced at all or produced in a way that's ineffective in controlling the pituitary gland. Without the release of GnRH and the subsequent release of LH-FSH from the pituitary, the ovaries or testes are not able to function correctly. The incidence of Kallmann syndrome and CHH has not been accurately determined, but it is thought to be in the region of between 1 in 10,000 and 1 in 48,000 live births. At present, there are approximately 4 male cases for every female case. Part of this might be due to misdiagnosis in females. Kallmann syndrome and CHH can be difficult to diagnose. Sometimes it's a case of excluding other possible conditions that can give rise to similar symptoms. Peak age for diagnosis is the late teenage years and early 20s. Earlier diagnosis is possible in some cases. The range and severity of symptoms can vary widely from case to case, even in close relatives. The amount of pubertal development can also vary between patients. Effective treatments, both for hormone replacement and fertility, are available. Kallmann syndrome and CHH are complex conditions. They are genetic conditions with over 30 different genes known to have caused cases of the condition. There are certainly more genes yet to be discovered. The majority of these genes control the activity of the signaling pathways between the hypothalamus and pituitary. As the brain develops in early life, between 10 to 14 weeks, different genes are responsible for different stages of development. Problems with one or more of these genes can cause the hypothalamus or pituitary not to function correctly and can lead to a case of Kallmann syndrome or CHH. The genotype of a person describes the genes that make up that individual. These genes can either be directly inherited from either parent as a perfect copy, or sometimes genes can arise which are different from either parent. A gene might have a variation or defect that makes it different from the copy of a parent's. The phenotype of a person describes the physical characteristics of that person, such as hair color, height, and facial structure. The phenotype is a result of the genes they carry and external environmental factors, which can influence how genes work. This means that identical twins might have exactly the same genes present, but differences in how these genes work can give rise to different physical effects being present. This can be very important in Kallmann syndrome or CHH, where somebody might inherit a gene that has been known to cause Kallmann syndrome or CHH, but that individual might not always show the physical symptoms of the condition. However, there are earlier signs that the condition could be present. Normally, just after birth and for the first 6 months after, there's a surge of hormones produced by the pituitary gland and the ovaries and testes. This is as a result of the baby's pituitary taking over production of its own hormones. This mini-puberty primes the hypothalamus-pituitary-gonadal axis, or HPG axis, so it's ready for action later when puberty is due. This hormonal surge after birth is absent in people with Kallmann syndrome or CHH, as their hypothalamus is unable to release GnRH correctly. In females with Kallmann syndrome or CHH, it's not clear if this lack of mini-puberty at birth has any effect later in life. In males, however, this lack of hormonal surge after birth and low levels of GnRH during the later stages of pregnancy can in some cases lead to cases of micropenis and undescended testicles. After 6 months, the whole HPG pathway is shut down until the age puberty is due. At the age puberty is due, the HPG should start up again to allow normal puberty, delayed puberty, partial puberty, or no puberty. This lack of mini-puberty can be used as a diagnostic test for newborns where Kallmann syndrome or CHH is suspected. Kallmann syndrome and CHH can be associated with a range of different symptoms, in addition to the lack of puberty and infertility. These can normally be classed as reproductive or non-reproductive features. Whether an additional symptom is present or not is normally linked to the gene or genes responsible for that particular case of Kallmann syndrome or CHH. The severity of additional symptoms, as well as the amount of pubertal development experienced, can also be influenced by the specific genes present. Hormone replacement therapy aims to replace the hormones normally produced by the ovaries, estrogen and progesterone, and testes, testosterone. The exact form this treatment takes may depend on whether they are used to induce puberty or to maintain the hormone levels normally seen after puberty. In males, taking testosterone will not cause the testicles to increase in size, but otherwise pubertal changes should be the same as in any other male. There are various products available for both men and women for HRT. Sometimes some methods are more suitable than others. The ultimate aim is to maintain the hormone levels within the expected normal range. In females, estrogen is normally used on its own initially to ensure maximum secondary sexual development before progesterone is added at a later date. In males, testosterone is normally started between the ages of 12 to 14, depending on height, with levels rising gradually to adult levels. In the majority of cases, HRT will not be able to induce fertility in either male or female patients. Fertility treatments are available for both males and females. The main form of fertility treatment is known as gonadotropin therapy. This involves the replacement of the hormones LH and FSH, normally produced by the pituitary gland. FSH activates sperm production in males and allows for egg development and estrogen and progesterone production in females. LH activates testosterone production in males and the correct release of the egg in females. LH cannot be produced as an injection, so a different hormone, called human chorionic gonadotropin, or HCG, is used instead. Females with Kallmann syndrome or CHH are normally born with the normal number of eggs within their ovaries, which means fertility can in some cases be achieved within 2 or 3 months. Males, depending on the initial volume of the testicles, have to take FSH-type injections in order for the testes to increase in size enough to allow for sperm production. This can take between 12 to 24 months. An alternative form of treatment is the use of GnRH pump therapy. This treatment replaces the missing GnRH and makes the pituitary make its own LH and FSH, which can induce both puberty and fertility. Due to the very nature of normal GnRH release, this type of treatment requires the use of a pump that delivers very small amounts of GnRH throughout the day. This type of treatment is not widely available outside specialist treatment centers and clinical trials.